Evidence-based home visiting programs provide in-home services to address parenting, health, child development, and the socio-economic needs of families. But what supports are needed to ensure families receive high-quality home visiting services? What does that look like in terms of service delivery? And what about the supports needed within the community and state and at other levels of the home visiting system? Currently, there is no agreed upon definition of implementation quality for home visiting.
You have mental health services, you have health services, education, safety. All of those things are part of the provision of home visiting services. And added to that, each family is unique. So home visiting is not a one-size-fits-all approach.
To promote a common understanding of implementation quality within home visiting, researchers and home visiting implementation experts looked at what constitutes implementation quality in home visiting. The project team engaged awardees of the Maternal, Infant, and Early Childhood Home Visiting, or MICV program, grantees of the Tribal MICV program, and other experts to develop a conceptual framework of home visiting implementation quality.
So I was invited to participate in the discussions around the development of the implementation quality framework from an awardee representative perspective. I took the questions that were being asked back to my team in Indiana and brought the full perspective of my team to the discussions. There were folks from all over the country, from both researchers as well as awardee representation.
Researchers also conducted a review of the literature and existing quality measures to inform the development of this conceptual framework. While there are significant gaps in our empirical understanding and measurement of implementation quality, given the limitations of prior work in this area, the knowledge that does exist help provide a foundation to build upon. Based on this review and what we learned from awardees, grantees, and other experts, we developed a conceptual framework that reaches across the home visiting system, from families and home visitors to the state and federal levels. The family is at the center of the framework. Next is the home visitor, followed by the local implementing agency and the home visiting program. The community systems and context, like other local agencies and services that support families, is the next level. Finally, the outer level includes state agencies, tribal organizations, model developers, funders, researchers, and the policies and political environments at the national, tribal, and state levels. The conceptual framework identifies 9 potential aspects of quality that we refer to as threads across the levels. Value and respect for family context, culture, and voice. Commitment to promoting racial equity. Flexibility and responsiveness to emerging needs and circumstances. Understanding of home visiting theory and content, strong fiscal support, compensation structures, and sustainability, systems that support monitoring, accountability, and continuous quality improvement processes, qualified, stable, and supported workforce, adequate resources, tools, and time, coordination, collaboration, and relationship development. We hypothesize that support for these quality threads across each level of the home visiting system promotes quality program implementation, which leads to high-quality service delivery and positive outcomes for families and children.
Diagramming the interconnectedness of quality and creating a visualization of the work that we do really makes a difference. It's a whole lot easier to have a conversation with people from a variety of perspectives when you have a visual to guide that conversation. The framework itself creates a way for us to have a conversation and talk about where quality activities need to occur, which stakeholders need to be involved in those conversations. And I think that that's the great success of where we landed with the framework.
For more information about the conceptual framework, please see the full conceptual framework report on the Health Resources and Services Administration's website.